Welcome to our video on kidney complications. This is rare in systemic sclerosis, but when it happens, it's serious, so we need to know about it. Usually, the patient has no symptoms at all, and that's what makes it even more challenging. Sometimes you might notice frothy urine, so when you pee, you can see frothiness in the urine. Occasionally, you might see blood in the urine. Those are all markers to say, hey, doctor, I need your help. Some people might get a headache, and occasionally people get seizures if the blood pressure rises. So the headache can be due to high blood pressure. And when the kidneys fail or are in trouble, blood pressure goes up. The reason I'm talking about this is there's a condition called Scleroderma renal crisis, which is a very serious, treatable, reversible complication of systemic sclerosis. It occurs in a subset of patients, and particularly we worry about that antibody called RNA polymerase III. It presents with high blood pressure. So what I tell all of my patients is they must know their baseline blood pressure. What is my blood pressure on a normal day? And I want you to know that and to write it down. If your blood pressure rises by more than 20 millimeters of mercury, either the high number or the low number, it doesn't matter, and that's consistent over a couple of days, even with no symptoms, you need to call your rheumatologist, call your family doctor, and or present to the emergency room. When you speak to a physician, especially one who is not familiar with systemic sclerosis, you tell them that you're at risk of Scleroderma renal crisis, and could they please check you out? And if you contact the Scleroderma Canada, they have little wallet cards that you can keep in your wallet. So I've said, if your blood pressure rises 20 or 30 millimeters more than its normal baseline, call for help. If we determine that you do have Scleroderma renal crisis, the treatment is actually pretty simple. It's a one particular medication that brings the blood pressure down and takes that pressure off the kidneys and allows them to recover. So those treatments are called ACE inhibitors. All rheumatologists should know about this, and emergency room doctors should be made aware that there is a good treatment for this. So that wraps up our video on renal involvement.